Good morning. I'm Fiona Cuthill from University of Edinburgh, and it really is my pleasure to welcome you here to this ACES conference this morning. I'm delighted at the number of people that are here, and also from so many different sectors. That's one thing about ACES, it brings together people from many different sectors together to think about this issue. So really hope that you enjoy this day. I think for those of us who have worked with families and young people in a health and social care environment for many years, we've always understood that there's a connection between hard childhoods and adult lives. And I worked for many years as a community nurse for asylum seekers, refugees and people experiencing homelessness. And I've worked for many different organisations and had different labels on the job that I've done. And yet the experience is that actually when we work with real life people, that life is complicated and we as human beings are complex. And I think it's really easy to get sucked into that complexity. And when we work with people, we can either get really involved in the complexities of people's lives, whether that's to do with domestic abuse, childhood neglect, poverty, criminal activity, whatever is going on, harmful substance use. And we can either get all mixed up in that complexity, or we can really oversimplify things and we start to put labels on people. And as a society, we can do that really easily, where somebody can be seen as the feckless alcoholic or the problem family or the rough sleeper out there smelly. And yet I think what ACES does is that it takes this middle ground. For me, it sort of takes all these different ideas and experiences that we know people have in life, and it actually names it. It gives us a common language that no matter whether we're coming from a policy or academic practice background, criminal justice, housing, health, education, whatever sector we come from, it gives us a common language and a middle ground to think about how experiences that we have in childhood can then carry on and shape our adult lives. I think another thing about ACES is that it makes it very measurable. The complexity of all of our lives, but particularly for people who've lived really tough lives, then it makes it measurable. And we know that we live in a world where experience needs to be measured. It needs to be measured because interventions need to be cost effective, and the way that we get money and we procure contracts is based on cost benefit analysis. So ACES in some way help us to make our experience more measurable. I think one of the really great things about ACES is that it actually focuses on the causes, not on the symptoms. And I speak for myself and maybe many others that actually whether we're in policy, research or practice, whatever sector we come from, we focus on the symptom. We focus on the harmful substance use, we focus on the criminal activity, we focus on the ability of whether someone can hold down a tenancy or not, we focus on whether someone is an attender or non-attender at services. We focus on that problematic person, that family that are constantly there and we find really difficult to deal with. But ACES takes us back to the beginning. It says rather than focus on the symptoms, let's focus on the causes. Let's look at why it is that people choose to live lives in certain ways and that they are and they be in this way. And so ACES takes us back to the causes, and that also drives what we now know is to be trauma-informed services. And this is a really exciting time to be in Scotland. There are so many different drivers that are all working towards the same thing, looking at how policy, how research and how practice can be trauma-informed. And trauma-informed means that rather than we focus on the behaviour, we focus on the causes and what traumas have people experienced in their lives that mean that we are looking at the way that they live their life in a certain way. So each of our speakers brings something different to our conference today. The great thing is that they all bring really high quality research, and they're going to tell us about what we know about adverse childhood experiences. There's lots of things we don't know as well, and there's a time for questions that we can ask each other, pick apart some of these things, really explore them in greater detail. It's really great in Scotland. There's a real sort of energy around ACEs. That has largely been led by the Scottish ACEs Hub, which is a collaboration with the Scottish government established by NHS Health Scotland to really help shape the actions identified in the Scottish Public Health Network report, Polishing the Diamonds, Addressing Adverse Childhood Experiences in Scotland. And I'm sure many of you here have read that report. But ACEs need to also make sure that they become not just at this sort of conferences and at this level, but actually that practitioners and people who are working at community level, regardless of in which sector, are really understand ACEs and know the language of ACEs. So today we're going to have some answers to some tricky research questions that have been posed, and we've got a really great group of expert researchers who are here to share their research with us. But we'll also raise some questions, and we'll have an opportunity in our discussions to think about those questions a bit further.